evening and welcome to another edition of the Borno Health Update. I'm your host, Ibrahim Amarawa. The program is designed to shed light on the remarkable strides being made in our healthcare sector under Governor Zulum's visionary leadership. In the program today, we focus on the transformative efforts spearheaded by Professor Baba Malamgana, Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare systems. The shortage of skilled human resource for health remains a persistent global challenge. In defiance of these odds, the Zulum's administration has implemented a multifaceted strategy to reduce this deficit to a minimum. Key initiatives demonstrated the government's commitment to producing more qualified health professionals, included the establishment of the Kashim Ibrahim Medical College and Teaching Hospital, new colleges of nursing and midwifery in Goza and Mongono, and now Eye and Dental Hospital Maiduguri will serve as a training center for medical professionals. The Commissioner for Health elaborated further on this development.
Appreciating the Medical and Dental Council of Nigeria, led by the registrar, the CEO of the council, in the person of Professor Fatima Abakari, who happens to be a daughter of the state and who happens to be the first female registrar of the Medical and Dental Council since it was established in 1963. She led 21-member team to Maiduguri to come and assess and accredit healthcare institutions in the state. This included the University of Maiduguri Teaching Hospital. It included the Borno State Specialist Hospital, the Dental Hospital, and also the Kashim Ibrahim University Teaching Hospital, as well as the Al-Ansar University, which is also offering medical students and other allied courses. So it was a one-week tour for them to come here, and we're very pleased with the way and manner they worked in the state. You couldn't ask for anything better. They were calm, collected, and very respectable, and we're very happy that they have gone round the State Specialist Hospital, the nook and corners, and have assessed the situation and have increased the number of house officers that until now we have 12. That's been now increased. I'm very happy to say. So we can be able to serve the people of Borno State better in that context. The dental hospital is also has been in existence for a long time. Unfortunately, it doesn't exist as a training facility until now. With their coming, we are now able to start training house officers, and for postgraduate, we will now approach the relevant bodies to come and advise us on the way forward. So we are immensely grateful to the Medical and Dental Council of Nigeria for this. They have visited the Kashim Ibrahim University Teaching Hospital and Medical College, where they spent a lot of time in the medical college, quite rightly. They've gone through the various departments, the basic sciences department, and they have seen the laboratories and the teaching facilities, and they were quite happy that we have got what it takes to train medical students to become doctors eventually. So, they have given their nod that, with small adjustments they have suggested, we can be able to carry on. And of course, the facilities are standard, and the facilities were not restricted in terms of numbers or classrooms. So the lecture theatre can easily accommodate 250, 300 students at a time, and there are at least 2 of such lecture theatres. The library stood out as one unique center, which they think is one of the best in the country. The library, with the e-library by its side, was really very resourceful, and they commended it very highly.
Providing more detail on the government's efforts, the Chief Medical Director of the Hospital Management Board, Professor Bakar Ali Kollima, highlighted the administration's work in constructing, revitalizing, and re-equipping general hospitals across the state.
We all know the larger population of patients who are staying here. We have 7 hospitals within Maiduguri and Jere, starting from State Specialist Hospital Maiduguri, Umaru Show Ultra Modern Hospital, General Hospital Molai, Infectious Disease Hospital in Jimchilo, General Brigadier Abakari General Hospital, Mariam Abacha Women and Children Hospital, Mamman Shoa Memorial Hospital, Gonge Maternity, and then eye and dental, as well as psychiatric hospitals that are within Maiduguri. These are those, and all have received their own share of the renovation. And currently, if you go into State Specialist Hospital, there's brand new ward. That was a G+2 that has been completed and awaiting commencement of service in the new orthopedic ward. And if you now move down within State Specialist Hospital, there was a recent solar upgrade that was made. The special care baby unit was upgraded. And also, there are ongoing renovations to give a facelift, to the hospital. This is one of the central and the key facilities taking care of virtually about 60% of patients within Maiduguri. And in that specialist hospital, not only that, His Excellency has also given the approval to the construction of new accident and emergency and general outpatient, departments, and to provide, staff accommodation, has renovated the Buba Marwa House Officers' Quarters. And then recently we had an accreditation visit from the Medical and Dental Council of Nigeria that was so happy with the state of facilities that they have seen in state specialists, upgraded the house officers training from 24 to 40. And so also in Dental Hospital Maiduguri was also one of the facilities that have been accredited. And the new ward as well as theater was built to ensure that the patients, dental hospital who are having their surgical, management in state specialist hospital are now going to have the services within the dental hospital. And the new ward has also been commissioned in that respect, was furnished, and it was fully, equipped and ready. So it was in that direction that also we have the courage to guts to invite the Medical and Dental Council to give us accreditation for the accreditation of dental, house officers, and they have graciously given us approval to train, dental house officers. And going to the area of human capital development, there was ongoing, construction of new orthopedic ward, new orthopedic hospital that is currently ongoing along Muna. And hopefully during the last visit of His Excellency, the contractor says they are going to complete hopefully within the first, quarter of 2026. And we have already projected in our 2026 budget for the supply of equipment as well as furnishing. Way to get human resource for health is not through recruitment, but through training. And in that direction, His Excellency in his wisdom, last year, if you could remember, or last 2 years, launched the community nursing and community midwifery, scholarship scheme. And these attracted from the various, local governments. And then, and hopefully they are going to graduate this November. And this is also one of the ways we're going to improve on the human resource for health that were needed in those facilities. And equally, we have our medical students, who are studying in various institutions of higher learning. And also the College of Medical Science in the Borno State, or Kashim Ibrahim University, has also commenced the training, and they were going into the third year. Recently, we had a visit from the Medical and Dental Council to see our state of readiness before the commencement of the clinical services. And hopefully in the next, 2 years, at least we're going to have our own institution graduating our own medical students to be doctors to train. And then the 3 colleges of nursing existing in the 3 senatorial zones are also going to produce the human resource for health necessary for us to post, to those facilities to work. But even recently, before those ones would materialize, His Excellency has graciously given approval for the recruitment of 39 medical doctors and also another, set of nurses, to complement the ones that we have. We all know that once you want to produce or open any facility, the most important thing is not the physical infrastructure, not the equipment, not the furniture you are supplying, but the human resource that will provide those services. We are all mindful of this. We have taken our audit, and we know we did our gap analysis, and we know the specific, specialties and cadres that we need to, supply, provide to these facilities, and we are proactively, working with government to ensure that all the possible, ways that we can get this human resource for health are provided. And then those even currently working also need to improve. We are improving, increasing services. When you increase the service outlet, you need to increase the human resource for health. Once you are specializing, you need to also have a platform where you are going to increase specialization. And recently, His Excellency has also given the approval for the recruitment of 30 Egyptian doctors. We have completed all their documentation process, and by the 23rd of November, all the 30 are coming. And this will also further improve, the human resource for health, as well as will commence the skills transfer from the experts that are coming in from Egypt. So that by the time they were leaving, at least we have an on-the-job, training of our staffs who will now take over some of these services that we ordinarily that need to, recruit. So this are the long-term measures that are put in place to address the human resource for health gap, as well as the skill, upgrade to meet the yearnings and aspirations of our patients, of our team, patients who are coming to these facilities.
That was the Chief Medical Director with an update on the revitalization of Borno's healthcare system. Borno Health Update goes beyond engaging policymakers. We also take you into the field to show you the reality on the ground. We visited the new Emergency and Infectious Disease Center established by Borno State Government with the support from NNPC, and we spoke with the management staff about the facility's progress so far.
Well, as the name implies, this is a hospital that is built for a particular cases in the state, because Borno State doesn't have any infectious disease hospital apart from the one that Mariam Abacha, which was converted to Mariam Abacha Women and Children Hospital. So having that in mind, the state like Borno State without infectious disease hospital, they found it necessary to have another befitting one. So this hospital was built as an emergency and infectious disease hospital to cater for all emergencies related to highly infectious diseases. We will recall during COVID-19, one hospital was identified to cater for such cases. That is the one at Ngarnam, now turned to General Hospital. So based on that ground, this hospital was now designed to cater for infectious diseases in Borno State. The hospital is just recently connected to the national grid in terms of power supply, and even from the inception, we have 2 standby generators, 365 kVA and then 250 kVA, in addition to the power supply, national grid. And also we have a solar system attached to the hospital in case of emergency power outages. That is 150 kVA power solar. Yeah, we have. So water supply also, the hospital has a very strong borehole connected to the national grid and the solar system. As we have gone around the hospital together with you, you have seen we have two wards, male and female, that is A and B. That is for patients to be admitted on the ward. Then we have a laboratory services. We have X-ray department, we have pharmacy department, and then we have emergency outpatient treatment center, whereby, you know, as a hospital by name, even if you say it's an infectious disease hospital, that you cannot stop anybody coming to the hospital for his other elements. And so there is a center to cater for that purposes. You can see on the downstate, we have a spacious reception center for OP.
The hospital has a 300 bed capacity. We have laboratory, but we need laboratory equipment. As I said, we have the lab as in building, but we need the equipment. We have X-ray. We have X-ray. And then we have pharmacists. We have pharmacists. These are the things we have. And we have nursing services. This hospital, as the name implies, emergency and infectious disease hospital, we attend to emergency cases like cholera, diphtheria, viral hemorrhagic fevers like Ebola, and emergency cases. Yeah, we started these services since last year, September 2024. We have enough human resources. We have enough. But our limitations now is our laboratory equipment. We need quarters. These are the things that we needed urgently because it will help to promote the hospital.
Despite significant security challenges, the medical officer and chief nursing officer of the Emergency and Infectious Diseases Hospital commended Governor Zulum for his transformative impact on Borno's healthcare system.
His Excellency has done so much, even beyond our expectation, because at the time we called, we never expected that he can come as soon as he did. Honestly, he has done everything. He has renovated, he has provided all, and he's still doing it. He's still doing it. We commend his effort. We appreciate it. We appreciate him much. The Commissioner of Health, I've been to ministry through the Permanent Secretary. We have been relating our complaints to him via the Permanent Secretary, and he has done so much because without his effort, even the Excellency cannot hear us.
His Excellency has to be commended for his determination to transform the health sector in the state. You can go around all over the state. Recently, we have commissioned 2 colleges of nursing and dental hospital and eye hospital, Monguno and Biu. These are commendable effort, step moved by His Excellency to see that the people of good people of Borno State enjoy an uninterrupted healthcare delivery services. And coming to where I am now working as the Chief Nursing Officer in charge of the hospital, when we came in, I told you earlier that this place is inhabitable, and I can put it that way, because you can't work in an environment where your office is leaking. And moreover, there's no power supply then when we came in. Today, I'm pleased to announce that we have sufficient power supply and then water system. In the first place, the Honorable Commissioner of Health is one that have given us a strong attention to this hospital, because when we came in, it wasn't under HMB. So it is the effort of the Honorable Commissioner of Health that makes this giant move to come and open this hospital.
Well, viewers, with this, we have come to the end of this week's edition of the Borno Health Update. Join us next week for another interesting segment. Until then, I'm Ibrahim Amara reminding you health is wealth and Borno is on the rise.